What does informed consent for an atypical antipsychotic look like? This is medications like Abilify, Seroquel, Risperidone. My name is Dr. Reed Sutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent before starting a psychiatric medication, as well as concepts of safety prescribing. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications and go through the informed consent process as I would with one of my patients. Now, the atypical antipsychotics, it's a really big category, and so I may need to do individual videos on the different medications. So if there's one that you specifically want to hear more about, then put it in the comments below. So medications that are included in this class include things like risperidone, otherwise known as Risperdal, quetiapine, otherwise known as Seroquel, olanzapine, otherwise known as Zyprexa, clozapine, otherwise known as Clozaril, ziprasidone, otherwise known as Geodon, lorazepam, otherwise known as Latuda, and more. So this class of medications was developed after the typical antipsychotics to try to mitigate the side effects of worsening negative symptoms from the typical antipsychotics, which was due to that very strong dopamine blockade. So the atypical antipsychotics have less strong of a dopamine blockade, but they do act more on other receptors, things like serotonin, acetylcholine, norepinephrine, and histamine. And because they act on these other receptors, they can have a lot of different potential treatment applications. So they treat psychosis, but they also have a lot of mood properties. So they can be used for treatment refractory depression. They can be used for bipolar disorder, either mania or stabilization or depression. Similar to the typical antipsychotics, sometimes they're just used for aggression. They can also be used for things like tic disorder and off-label for a lot of purposes like insomnia or OCD and others. Again, this is not an exhaustive list. People use these medications for lots of different purposes. So in terms of side effects, they're going to have all of the potential side effects of the typical antipsychotics, but it's going to be less likely because they have less strong of a dopamine blockade. Primarily the ones that we're thinking about are things like extrapyramidal symptoms. So this can be muscle rigidity, tremor, dystonia, which is when you have an uncontrolled muscle contraction, tardive dyskinesia, which is where you develop uncontrolled muscle movements over time, like lip smacking or blinking, or Parkinsonian symptoms like a slowed gait, a tremor, or masked faces, where you have basically no expression on your face. Any of these are possible with the atypicals, but less likely. The side effects that are pretty unique to the atypicals are the metabolic ones, and these can be a huge reason that people can't stay on these medications. So this includes things like weight gain, increase in blood sugar and cholesterol. And so for this reason, in addition to monitoring things like your blood counts and your metabolic panel, we also need to monitor blood sugar and lipid panel when you're on this type of medication. Now, some of the specific medications in this class may be better or worse for this type of symptom, but it's a risk with all of them. Other potential side effects include sedation. Some of them make you very sleepy, so we recommend taking those at night. Those that have anticholinergic activity can cause anticholinergic side effects, things like dry mouth, dry eye with associated blurriness, urinary issues, constipation. And I've talked about NMS, or neuroleptic malignant syndrome, in another video. This is also a risk with the atypicals, less so than with the typicals, but it's still a risk. And because a lot of these have serotonin activity, there's also the risk of serotonin syndrome, depending on the other psychiatric or somatic medications that you may be taking that also have serotonergic activity. There can be sexual side effects, especially when there is a change in your prolactin level. So this could be decreased libido, difficulty achieving orgasm, all that, but it also could result in menstrual irregularities for women or gynecomastia for men, which is where their breast tissue actually grows, as well as lactation. Like a lot of our psychiatric medications, we also warn patients about the risk of suicidal thoughts. And most of them are going to decrease your seizure threshold to varying degrees. And one of the reasons that we have to check your complete blood count is that some of them can cause a drop in your white blood cell count, which can be really dangerous. Of course, there's also going to be things like dizziness, headaches, GI upset, all the typical things that could happen with basically any psychotropic medication. And akathisia can be a really potentially dangerous side effect where the person has an internal sense of restlessness. They feel like they have to pace, they can't relax, and it can be really intolerable for a lot of people. Now, this list of side effects is not exhaustive. I'm sure you all could share with me some other ones that you have experienced, and feel free to put those in the comments. As far as withdrawal from this type of medication, it's similar to antidepressants in that your brain adapts to the influx of the medication and becomes dependent on it. And so if you stop it abruptly, you're going to be at significant risk of withdrawal symptoms and or relapse of illness. So I would advise taking the same hyperbolic taper approach as I would with an antidepressant. And it's also important, depending on your personal history, to consider other interventions to prevent a recurrence of illness as well. Of course, this is something you should do working with your mental health provider, so please don't try and do it on your own. So after going through all of that, I would ask the patient if they had any questions, and we would talk about whether the benefits of the medications would outweigh the risks for that individual. If there's any other medications or specific antipsychotic you want to hear about, then put it in the comments below. Wishing you all good mental health, and I'll see you in the next one.